Welcome back. It's pretty common for women to take care of everyone around them, but they also need to take care of themselves. In October, we remind women how much they are loved when they are reminded to get that mammogram. And breast cancer will affect 1 in every 8 women. Early detection is key for a higher success with treatment. Join us to continue this discussion is Dr. Paul Wright from Spectrum Health's Lemon Holton Cancer Pavilion. Good morning, Dr. Wright.
Good morning. Thanks for having me.
It's our pleasure. So why is it so important to recognize Breast Cancer Awareness Month? And then on the other side of this, what do you want women watching this morning to take away from this?
Sure. It's really important to recognize because breast cancer is the most common cancer that occurs in women in the United States. And just this year, there will be nearly 300,000 new cases of breast cancer. So many of us have been touched by breast cancer in some way, either personally, by someone we know and love. And so it's important to recognize and celebrate those who have fought or are fighting this disease. And the takeaway is that breast cancer today is often very treatable and curable. But like you said, early detection is very important and can potentially reduce the extent of the treatment and certainly saves lives.
So how often should a woman be screened, and then starting at about what age?
Yeah, so for the average risk woman who doesn't have a strong family history of breast cancer, we typically recommend that they start screening with a mammogram at age 40 and continue with yearly mammograms from that point. If you have other risk factors, like a strong family history, sometimes the recommendation is to start screening at an earlier age or screen in a different way. And so if you have any of those features, you should certainly talk to your doctor about that and get a screening plan that's right for you.
And many times there are those red flags. So what are those signs and symptoms that we should be keeping an eye out for?
So we describe it these days as something called breast awareness. And really what that means is just that women should be familiar with their breasts. If they notice any changes from their normal, they should contact their doctor for further instruction and decide if you need to be seen for that or have something done.
And then also you guys have a mobile mammography unit, right?
Yes, we actually have 2 of them. So the mobile mammography units are a really neat initiative. The goal is to make it easier for women to get their mammograms. As you said in the intro, women are known for taking care of others more than themselves. And sometimes when life is busy, it can be hard to just make that time to get out and have your mammogram done. The mobile mammography units go closer to where you're at. There's a monthly schedule that is advertised every month for where that will be on any given day. And the nice thing is that it's the same quality mammograms that you would get at any other facility. They have the same technology. It just makes it more convenient.
I know with everything going on right now, too, a lot of women are putting off those screenings and those health exams and something like that. So we really need to stress to women to follow through with these things. You guys have plenty of precautions in place to make sure that everybody has a wonderful experience and a safe experience.
That's right. With the pandemic going on, it has led to some challenges, but we've been very dedicated to making things safe so that screening tests can continue. And we want to make sure that, again, if something is identified, that it gets caught early and in its most treatable form.
All right, so once again, if you could just go ahead and let everybody know where they can find out the schedule for this unit and also where else they can go, or just simply turn into their doctor to get that schedule put in place too.
Yeah, so it's listed on our website at spectrumhealth.org, and the information should all be there. And then if you notice a lump or something concerning in your breast, please contact your doctor immediately. Don't wait and get it checked out. Most of the time it might come out as nothing, but we need to have that investigation happening so that if something does need to be done, you can get prompt treatment.
Thank you so much for your time. SpectrumHealth.org/mammogram, or go ahead and check out the app that Spectrum Health has as well. Thank you so much for your time.